Hello, my name is Bonnie Sept, and I am a patient partner with the Department of Critical Care Medicine for about 5 years now at the University of Calgary. Briefly, a patient partner is someone who connects ICU patients and their families with research. My mom became very ill in her 80s and had to have surgery about 15 or so years ago. She was then admitted to ICU. During this period, we had limited contact with her and the medical staff. Mom's recovery was complicated by delirium syndrome, an abrupt change in the brain that caused confusion and affected her ability to manage her emotions. She showed signs of discomfort, anxiety, and fear. When she was ready to be discharged, we were left with many questions. As a caregiver, it was an emotional and difficult experience. Simply put, we were a mess. I wanted to become a patient partner because of my experience with my mom. While not only seeing the situation with my mom and the stress and emotion we went through, but I also really wanted to help families and patients to become more involved and feeling valued to be such a great part of their loved one's journey. I strongly believe that patient care improves when researchers, families, and patients share knowledge, involvement, and education. This process would have significantly helped our situation. The studies I participate in as a patient partner helped me realize the condition my mom had so many years ago. I am involved with studies that evaluate family engagement with patient care. For example, there are studies assessing the way families can participate in the prevention, detection, and management of delirium in their loved ones. Also, studies that create tools for families to measure the level of pain that their loved one is experiencing. I connect patients and families with research because, in order to see if these family engagement strategies are valuable, we need to conduct these studies. Having my ICU experience as a patient family member helps me to communicate this research to the patients and their families and explain its value without overwhelming them. I also help researchers to see the patients and families' perspectives. So, to summarize all of this, I feel that research is very critical for improving both patients and their families' experience in the ICU.